Welcome everyone to our webinar titled Living with PNH, a Patient Panel. Thank you for joining us today. My name is Lee Clark and I'll be moderating the presentation. As we get started, I'd like to thank the generous support of our corporate sponsors and our generous patients, families, and caregivers who support the program today. You may lose your connection during the webinar, and if you do, please use the call-in number in your reminder email to listen to the program using your phone. Today's program will be archived to our website within 2 to 3 business days. You will be notified by email when it is live and ready for viewing. During the presentation, our panelists will be taking questions from the audience, so please feel free to submit your questions at any time during the presentation. To submit your question or comment, open the Q&A window in the lower part of your screen. Type your question in the small text box window and just hit enter when you're finished typing. We'll do our best to get to everyone's questions today. When asking questions, I do ask that you do 2 things to help me manage the incoming questions. Submit your question all at the same time, and please do not share any private health information in your question. Our panelists are not medical experts and will not be able to answer any specific questions related to your health care. Our panelists today are Heather Rummery and Brandy Lewis. So welcome and thank you so much for joining us, Heather and Brandy. I'd like to get started with you all introducing yourselves. Brandy, would you like to start?
Yeah, I'll go first. Hello, my name is Brandy Lewis. I have been dealing with PNH since 2014 for me. Had a long, crazy journey with it, but definitely have learned a lot. I currently work in human resources right now as an HR generalist and have been in HR for about 5 years now.
Thanks, Brandy. Heather?
Hi, I'm Heather. I'm from Maine. I was diagnosed in 1997. I was 18 years old. I think I had it for multiple years before that, but my symptoms were the worst then, and I went to see a specialist. I look forward to talking with you guys and hope that we can help. Thanks.
Thanks, Heather. What led to your diagnosis? Heather, would you like to start?
Did you say Heather?
Yes.
Okay. I had fatigue for multiple years, which was unexplained. I had lower counts and low iron, so I did iron replacement for some years. But then the dark urine had happened twice, multiple years before, and then it started coming closer together. And that's when we realized that we had something different than chronic anemia. And so my primary care referred me to a hematologist, and that's when they started with the testing. And it really didn't take that long. I was very lucky, especially back then, with no flow cytometry test at the beginning. And he just ruled out so many things at once that this was a yes and this was a no. That meant it was this. It was like a puzzle. And he was really great. My hematologist was really great in listening to my information and putting the pieces together to get that unique diagnosis.
Thank you. Brandy, how about you? What led to your diagnosis?
For me, I was diagnosed previously with aplastic anemia only in 2009. When in remission, it came back. So we did just CBC blood count, saw that aplastic anemia come back in 2014. And my doctor just decided, hey, I've heard that PNH really goes a lot with aplastic anemia. I'm just going to do a test to see if you have PNH. Honestly, my doctor did not think that I was going to be diagnosed with both, but she ended up doing a test, and shockingly, it came back with PNH as well. So I would say I had the same symptoms, just fatigue, the same symptoms as I have with aplastic anemia, just really fatigue, nosebleeds, those types of things, heavy breathing, all of that.
Thanks, Brandy. And we'll go with you to start this question off. Once you were diagnosed, what did your doctor tell you about PNH?
Yeah, that's a good question because there's not a lot of research out there. For me, about PNH, of course, she gave me like a pamphlet and was like, hey, I need you yourself to go and research this. But she told me the minor things, the blood and the urine were the symptoms. So that was the main thing she wanted me to look for was the blood and the urine, of course, to see if I'm still having that fatigue, if I'm still getting those nosebleeds. So she really heavily, we talked more about the symptoms of it. She did tell me, explain PNH to me and how it actually works in my body. But mainly there wasn't a lot of research. She didn't have a lot of details on it. Like I said, she didn't even expect me to have it. So I definitely researched more on my own.
Heather, what did your doctor tell you at the time of diagnosis? What is PNH?
He was very, not, I don't want to say vague, but had some of the symptoms, and he did the best he could with what research he could find at the time. And we both kind of went at it looking, he would look through his, peer network and medical journals. And I found a lot of support and information online, even, before it was as great as it is now. But he did talk about the low blood counts. I only have low red cells. So we talked about how that could be treated with folic acid and iron. So I started very conservatively that way, because I know I had no platelet or white blood cell issues. We also have, pretty quickly got into the transfusion dependent part. And that was something obviously he knew about, being a hematologist oncologist. And so his expertise in that, even though it wasn't in PNH, I was really lucky that he was open to any information that I brought to him. And he was also very caring in that when I said, what about this or what about that? And he would answer whether he thought it was related or not related. And, very supportive and not dismissive, because each person is so unique with PNH that even though they have a pamphlet with a list, we're still very different. And so it's important to know what your body is doing and to bring that individual information to your doctor.
And Heather, at the time of your diagnosis, what did your doctor discuss with you as your treatment options? What was available to you at that time?
As I mentioned, the very, very conservative was the folic acid and iron, and then the transfusions as needed. I think kind of early in the game, we used a red cell booster. I'm not sure if I can say the name, but it was Procrit back then. I'm not sure. So I'm not endorsing anybody. It didn't increase my counts. I don't know if I made more red cells, but I know I made more damaged red cells. So we didn't continue that. So the basic treatment was the red cell transfusion. Also, I was explained that the only cure was the transplant at that time. I closely followed what was happening in Europe with leads and PNH, and so brought back the information for eculizumab when that was available. And so my doctor was very open to me learning more and trying to get into that treatment when it became available, because up to that point there really weren't any other options other than the stem cell boosters, not stem cells, but the white platelet or red, and the transfusions.
And Brandy, what did your doctor discuss with you as your treatment options at the time of diagnosis?
Yeah, when I was diagnosed with PNH, a new drug had just come out, was a new infusion drug. So that was a main drug that we really looked at of, hey, should I get on this infusion drug? But with that drug, of course, you have to get it every so often. I believe it was every 2 weeks at that time. And you had to get it on a set schedule. So that was a real concern for us of, is this something we should treat right now, or should we just focus on the aplastic anemia? But that was the one drug we truly, really looked at more than anything. Of course, having the blood transfusions, still getting those weekly at that time. But that infusion drug was the main one for me.
Or is it ever discussed with you, Brandy, about having a transplant?
It was, yes. So we definitely did discuss that having a transplant. I have two sisters as well. So we looked at them as well and maybe doing a haplo transplant. That was a heavy discussion as well. Yes, I'm glad you brought that up. So bone marrow transplant was one of the main options of looking at, and then looking at down the road, how would that affect me? That was always my main question in the back of my mind. I was diagnosed in my early 20s with PNH. So, I wanted to have kids down the road. I wanted to see how any of these drugs or having a transplant would affect me down the road.
And Heather, I think this is a question for you. It says, how much folic acid did you take and did it help?
I think I started at 1 milligram. I think I take 2 now. At one point, one of the specialists had me on 5. I think at a certain, I don't think folic acid builds up. I think you just release it. I'm a hand talker, so I'm sorry if you keep seeing my hands. But I know that there are people who take anywhere from 1 milligram to 5 milligrams, and it's a building block of red cells. So I assume that it has been helping all of these years, and I'm trusting in the experts to know that stuff.
We have another question from the audience. It says, how many bone marrow biopsies have you had? Brandy, you want to take that one first, and then we'll ask Heather the same.
Yeah, I've had quite a few, I'd have to say, and I've had more awake than I would like to have awake. I had around 4 awake, and I'd say around 5 of those asleep. So I've had around 9 of those. Not fun, but yes.
I think I've only had one. I'm trying to think if I had a second one or we only talked about it. Because I didn't have any aplastic symptoms, my only affected cells are the red cells. So they weren't looking at the aplasticity or how much it was growing or how much it wasn't growing or how much shadowing or was empty in my bone marrow. So it was something different to be looking at. I pretty much go by the blood counts versus what's actually happening in the bone marrow. So I don't know if that's the best answer to give for people, because I know some really like it, not like it, like to get it, but to receive that information. When I saw a specialist multiple years into my diagnosis, I didn't have a bone marrow biopsy done there. She worked just off the blood draw. So I think it depends on your situation and what they're looking for information from you.
We lost you there, I think, just for a quick sec. Oops. Okay. Can you guys hear me okay? Oh, good, good, good. So what currently are you using for treatment for PNH? Brandy?
So for me, I'm not on anything. What we do right now, as far as my treatment or watching my PNH, is I have a flow cytometry test that I get every 6 months done. And right now it has been stable. It has not gone up or down. If it has, it's been very minor. So I always have in the back of my mind of my options of treating PNH if I need it. But as of right now, I'm not on any meds or taking anything.
Heather?
I know I forget to unmute myself too. So I am still on Solaris. I have looked into the 8-week Ultomiris, but at this time we're going to stay with Solaris. I started it in, I think, 2005. I was on the clinical trial. So started it with everybody else, or continued it in 2007. And it has kept my numbers stable. And other than I'd like them to be higher and I would like to have less fatigue, I really feel like it's doing what it is supposed to do. So we're going to stick with that until some of the other things in the pipelines look like they might be a better fit.
Thank you. And Heather, I'll let you take this. What is the infusion treatment like? Like, what is the process and how do you feel while you're having treatment?
I haven't had any issues or side effects from my treatment. I go to a local hematology oncology office and have it in their treatment room. I think the infusion is 30 to 40 minutes based on what the sticker for the pharmacy uses. I'm not sure what the label says, but I have my blood drawn and they look at the counts, but they're not criteria for having treatment. Sometimes I see the doctor. Sometimes I just have the treatment, and I use an IV in my arm, and I don't get any pre-meds. I know some people do. I also don't have a port, which I know some people do. I'm holding out, again, not medical advice, personal discretion. I'm hoping for spontaneous remission. We'll see. That's what I've been telling them for years. It also depends. I've heard some people it takes hours because they get there and they see the doctor and then they have their blood drawn and then they wait. And where mine's a small office, it's not a hospital setting, there's, I'm not sure exactly how many chairs, but the pharmacist is pretty quick mixing it. They hang the bag. The IV nurses are really great. So I'm usually there 2 hours or under. It's a half an hour from home, so it's manageable. But again, like I said, some people are using pre-treatments, Benadryl, or other items, Tylenol. I don't have any of those, so it's shorter. But again, it's all, as you said, you talk to your doctor for the specific medical advice.
How long after you started treatment did you see a response to the treatment?
So, sort of a longish answer. Part of the issue is that I was on a clinical trial. So within, I think it was 2 or 3 weeks, you can tell whether the LDH goes down when you're on this drug. And so I was on the placebo. So I was on for the 6 months before anything changed. So I didn't see any difference because I was on the placebo, but once I switched over, it was, I think, 2 or 3 weeks, and we noticed that my LDH numbers came down steadily until they hit normal.
Brandy, how is your PNH monitored?
Yeah, so other than having, right now it's being monitored as just having a flow cytometry test done every 6 months, and thankfully it's been stable for me. But before that, I did, since I was diagnosed with aplastic anemia and PNH, I was treated with getting ATG or ATGAM. So I was in the hospital for a week, for 5 of those days, getting an infusion for 12 hours a day to treat both. I'd say it really did help with both for me. And of course, had the Benadryl that I'd take before would help out with that as well. But ATG was really what treated me and put me back into remission.
Are you currently off all medications for the aplastic anemia?
I am, yes. So I'm off of all meds for aplastic anemia and PNH, yes.
And you're just monitored with flow cytometry, you said every 6 months.
Every 6 months, yeah.
Okay. Thank you. And then how do you keep in touch with others regarding PNH? What sources do you use to stay abreast on PNH and the latest? And how do you stay connected with other PNH patients for support? Brandy, you want to take that one first?
Yeah. So for me, there's a really cool Facebook page that's for aplastic anemia and PNH patients and their families. So that has probably been my best way of getting information, being able to give information and great resources of things that have happened or helped me. Because I know in my journey, I did bounce around to different doctors just to make sure I got the best one to treat what I had. So that journey helped me, but I remember giving out a lot of information. I've actually kept in contact and am like Instagram friends with some of the people that I've met off of the Facebook page. And so we keep in contact contact and we'll message every now and again on each other's journeys. So I really love that. Right now, I've been dealing with one symptom of brain fog. I think that's the worst of PNH for me. So with that, being able to just kind of check in with people and then see if they're still having the same symptoms, just to make sure I'm not like alone in this. So that's been great.
Heather?
I would say that the Facebook group is probably one of my strongest connections also. I think it meets so many needs, the medical need where people are sharing what's actually happening with them and what's available. I think it also meets the support need because we're different in that we are unique individually and unique as a group. And so how it affects our lives in different ways. And we run the gamut. We run from people that work full time to people that can't work at all, people that are the caregivers, people that are the patients. And I feel like that group really fits all of it. And then from there, like Brandy was saying, you make specific connections over the years with people who are going through what you're going through at that moment, and you might connect on that separately. I've also met a lot of really great people at symposiums and conferences and through AAMDS peer connections. So I think the internet has really helped bring people all over the world together under one umbrella, specifically the Facebook at this time to meet that.
Have either of you suffered any complications because of PNH? Brandy, you want to take that one first?
Yeah. Any complications? That's a good question. I really haven't had any complications. Like I said, I had ATG to help treat both and have blood transfusions, platelet transfusions for many years, but I haven't had any complications from anything. Of course, well, I'd say from ATG, I broke out in hives, but of course you have the Benadryl and the Tylenol to help that. But no after effects, I'll say.
Thank you. Heather?
I've been pretty lucky as far as complications. I have not, to my knowledge, had any clots. So that's been very nice. I did have a bunch of bilirubin stones caused from hemolysis, which then I had my gallbladder out. So I don't know if you would consider that a complication. Finding that happens a lot in PNH patients. Actually, it's happening a lot more into the population, but supposedly our stones are made of different things than the general population. But I would say that's probably my only complication. There are a lot of them. There are a lot of things that people are experiencing. There's day-to-day things that I have, but no major complications.
And Brandy, this is for you. It says for aplastic anemia and PNH, are they monitoring your LDH with flow cytometry? I think you said yes earlier, but if you want to expand on that, it says, are they monitoring your LDH with flow cytometry?
Yeah, that's a good question. Yes, they are. So when I get flow cytometry done, it's monitored. Well, we're looking at everything, and that's honestly how I'm monitoring both right now, aplastic anemia and PNH is with that test I get done.
And did either of you seek a second opinion before you decided how you were going to proceed and manage and treat your PNH? Heather, would you like to start with that one?
Sure. I did not seek a second opinion. I felt that he was really thorough, and the way that the test came back, it was, as I explained, this was negative, this was positive, and so it meant this. At the time, it was the hands test, and then later on, the same doctor did the flow cytometry when it was more readily available. And so having the classic symptoms of PNH with the very dark brown Coca-Cola colored urine, I feel like I was a little bit more straightforward for diagnosing than if I had some of the AA or MDS symptoms, which might have been a little bit more unclear and where they, the Venn diagram where they overlap each other. And if you have a dual or a multi-diagnosis, you may want a second opinion for those specifics. But like I said, I had the fatigue, the low red counts, and the dark urine. And so it was pretty self-explanatory that way. But I do encourage people to get that second diagnosis or second plan of treatment if they are concerned at all, or even interested in just another opinion of what's going on.
Brandy, how about you? Did you get a second opinion before you decided how to manage?
Yeah, I absolutely did. Well, when I was first diagnosed with aplastic anemia by itself, I was 19 years old. So I was a sophomore in college and had never heard of aplastic anemia. So that was really where my journey started of getting a second opinion. And then the second time I was diagnosed with PNH being very new, even my doctor, everything she learned through me. I was her only patient with aplastic anemia and PNH. So we were definitely learning together. And so I did go get a second opinion, and actually probably a third and a fourth. So that's really why I've had so many bone marrow biopsies too. It's just going around to different doctors trying to figure out which one would be best for me. Not the perfect doctor, but the one that would understand me and I understand them. And how I actually found my doctor was actually at a aplastic anemia PNH conference, talking to some other patients. And that is how, and they gave us different names of different doctors. And that's how I found my doctor actually at NYU that helped me with both aplastic anemia and definitely with PNH. Yeah. So my doctor in New York helps my doctor here back home, and they talk all the time.
Thank you. And Heather, did you want to take a minute and talk about the PNH travel grant and how that can help PNH patients with seeking a second opinion?
I would love to. So there's been some changes over the past couple of years on the grant. And so really what it's for is if you are looking for a diagnosis, a second diagnosis, more clarity in your treatment plan, getting more information, looking for a specialist who's seen multiple people who can, like Brandy said, report back to your local doctor and keep you on the best course of treatment for yourself. The PNH patient grant would be wonderful for that. So it is a up to $500 grant that you apply for. It is available once a year, which is something that's new, to see a specialist and to ask for help deciding what exactly your diagnosis is, or deciding on the best treatment options. Lee and I were talking about the fact that there's so many new possibilities coming out and combinations, options right now. It's really great that there is a place where you can apply for some financial assistance to go and see someone. So it can include, the food while you're on your trip, mileage in your car, a train, a plane, the hotel, co-pays if you have things that aren't covered. One of the things that we want to make sure that people know, which I think has always been true, but I don't think people have really thought about it, is if you have a dual diagnosis, Brandy's been perfect to segue into this, where it says PNH patient, it does include people who have more than one piece, one being PNH. So the grant isn't for aplastic anemia patients, but if you have AA and PNH, or if you're lucky enough to have AA, PNH, and MDS, and you really do need that extra information from someone who's seen this multiple times. And that's difficult to have someone who has seen one diagnosis, let alone multiple. And so we encourage people that have multiple or dual diagnosis to, can you hear my daughter? I'm sorry. To apply because the clarity that you can get from someone who has that information. I also am my doctor I think has had two people, but it's not enough. There's not enough depth or breadth of knowledge to make some of these decisions. And so we would love people to apply for the grant. It's on the AAMDS website. We ask that you apply before your appointment. We also can help you think about who you might want to see. That can be based on your diagnosis, your potential diagnosis, your location in the country, what you're looking for treatment options. Brandy, did you receive a grant? Did you want to speak about that and just whether or not it was easy to follow through with and how you were able to use it personally?
Oh yeah, I'm glad you said that. I definitely want to talk about this. I was able to get the grant, thankfully. Actually, when I was traveling to go get a second opinion for meeting my doctor at NYU is when I used it. And we actually used it for our hotel stay, and it was perfect. I remember actually, I believe you all or Aplastemia PNH Foundation gave us information on like where to stay. So we got a lot of resources and used them definitely. So the grant was great for us. And we were very thankful for it. Of course, with me being young, I was actually living at home with my parents. So I was financially dependent on them. So it was great to kind of have that relief of being able to take something off of my parents and use that grant money. So yeah, it was awesome.
And Heather, we have a question. Does the grant allow for a support person to be able to travel with the patient?
The grant does. And so the grant will cover a support person. You know, sometimes it's a parent, sometimes it's a spouse, sometimes it's a friend. Really encourage people to have that second set of ears. Sometimes somebody writing down the answers, sometimes reminding the patient of the questions that they were looking forward to, because you get so overwhelmed and excited when you're there. And so having a support person in general is a great idea, but having someone at an important appointment such as that is really important. And I know I feel like I keep plugging this, but I think AAMDS has some information on that also, going to appointments and what you should do and what you should look for in the questions. And so, yes, we would love if people want to have a second person with them.
Thank you. Did either of you receive the COVID vaccine? Brandy, you want to go first?
Yeah, so I will say at the beginning, I was very apprehensive of getting it, but I did a lot of research on it myself. I talked to my doctor here and actually my doctor at NYU, and both of them were very much so on the lines of me getting it. And they gave me really, really good advice. Of course, it was still my decision, but I decided to get it. So I did the Moderna. I've only gotten the first one, and I'll go back and get the second one in early July. And I haven't had any problems either from it.
Thank you.
Yeah.
Heather?
Similar story. I checked with my doctors and asked a lot of questions. I also work part-time in a school. And so here in my state, they were bumped up to the top of the list, I guess you would call it, just after the first of the year. And so I was able to get the two-shot Pfizer, and that was a couple months ago. And so I had a little bit of a headache, and I would say I was fatigued, but it was nothing that I don't usually experience. It might have just been a down day. I had some medical professional friends go December, January, so I knew to beef up on my extra electrolytes and fluids and plan the next day to just chill. And I thought that it went well. It was very well done here. And I felt like most of the people who I've talked to that have PNH or other medical things, their doctors are encouraging them because of the potential, what could happen if you do get it. Again, everybody's different, and you, like Brandy said, the choice is yours in the end, but I used the information that I had and chose to receive the vaccine.
Thank you. Brandy, you mentioned you were diagnosed with aplastic anemia in college. How did you manage being diagnosed with a bone marrow failure and being in college? How did that work out? Like, what are some of the things that you did for any new patients that are being diagnosed as a young adult?
Yeah, I think that's like my niche is helping young adults in this area for sure. So like I said, I was diagnosed 19 years old, starting actually 2 weeks into my sophomore year of college. So for me, I felt like I had just got my freshman year over with, and I, was understanding how college worked. So 2 weeks in was when I was diagnosed or having the symptoms. And so I went around to different doctors trying to figure out actually what was wrong with me. But dealing with that, I decided to take a year off of school. So I was able to take like medical leave from school for a year. And then I actually took some classes my second semester of that year just because I was at home and really wasn't doing much. So I have to say I did have a very hard time for a little while, just because you feel so alone being so young, being diagnosed with aplastic anemia. And I remember going to conferences and meeting people, and it was funny enough that year I was diagnosed, a lot of like my friends were older people because they had dealt with it. And so it took me a little while to find people around my own age that had dealt with aplastic anemia like me. But like I said, the Facebook group that is where I've found people around my own age. I feel like I found people that understand me. And those are the people that I'm still in contact with today. I feel like we're kind of growing up together in this world, and we're all kind of in our late 20s or early 30s by now. So we all keep in contact with each other, which is great. But I will say it took me a while to figure that out and to find my people. But I took the medical leave from school for a year, was able to go back to school after that year. And I was a little apprehensive of, should I go back to school? Because I went to school 2 hours from where I live. So it was, do I travel 2 hours? And we just keep in constant contact with my doctors at home. So that was a whole nother story too, of, trying to make sure I had the right doctors around me. But I decided to go back to my school that was at my alumni school and graduate from there, which was great. So graduation was a big deal for my family.
What advice do each of you have for newly diagnosed patients or patients who are trying to make treatment decisions, and even those going through treatment? What advice do you have? Because they're very different subsets of patients. So, Heather, you want to take that one first?
I think that this one sort of is one of the most important questions, but it's also one of the hardest ones, because like you said, there's so many subsets. We're all under the same umbrella, but we all look completely different. So find someone that listens to you, whether that's your doctor, whether that's a support person, and make sure that you utilize that. I would also say that you know your body. So if the fatigue is different than usual, then you're going to say it's more severe, or it's less severe, or it's hard to use the 1 through 10 scales because my numbers are going to be different than others. But I know when I go to a number, that's a little bit higher, my nurses will notice, oh, that's a little higher for you, where it might be a different number for somebody else. And so just building those relationships with your support people and with your medical professionals, finding someone that you think listens to you well and also is engaging enough with you, and also with peers or other people who have that information that is useful for you to make those decisions. Making a treatment decision is difficult. And, back when I was diagnosed, it was if you needed a transfusion, you got one. And if you met the criteria for a transplant, then you chose to do one or not. But now there's like a plethora of options. And to find which one is best for you can be difficult. And, like Brandy was saying, the beginning for her treatment, she did it and it worked. And so then, you go for a while and then it changes, and then the PNH came out. And so then you have to make some other choices. So just making those connections and relationships with people that you trust and that you think can help you make the best decisions. And just ask, get on, they say don't look on the internet, but look on the internet for, people who have similar situations to you, and ask and ask and ask. And most of us would love to share our stories because we know there's only a few of us that have them. And if we can help somebody make a decision with the best information they have, we are more than happy to share.
Thank you. Brandy?
Yeah, I'm definitely going to piggyback off of what Heather said. First one is, you know your body more than anybody else. And I definitely have always stuck to that, even from the time of me diagnosed. You know when you're feeling bad. You know, despite the numbers, you know if you're nauseous, if you have a headache, you understand your body more than anybody else. Another thing I'd say is to find a doctor that you really that really understands you and you understand them. I mean, because that's a relationship, that's a partnership that you now have just started to develop. And for me, I have two doctors and it's great. And the three of us all talk. I mean, I call them sometimes, they'll talk to me or they'll talk to each other. So having that type of relationship was very important to me. And both of them knew that within my journey. So I have some very great doctors around and I'm thankful for that. I really don't know where I'd be without them for sure. A third thing is to have a great caregiver. My caregiver was my mom. And there, of course, with the brain fog, even at that time, there were things I wouldn't remember that my mom remembered, I mean, right off the bat. One thing my mom actually did was she would have a binder and she asked for copies of all of my counts. So she started doing that the first time I was diagnosed. So the second time when it came back, and we were looking for, that was when we found my doctor at NYU, he asked for that binder and he was able to actually just find everything he needed on me. So my mom took and asked for a copy of everything from the doctor because it is your information. So if that's something that helps you, it's just keeping a binder of all your information dated. That really helped my doctor at NYU to get just a synopsis of everything that was going on with me. And it just sped up the process for me in order to help me out.
At any point in time, did your medical teams ever discuss potential clinical trials with you? Heather, would you like to take that one first?
So I think I shared earlier that I participated in a clinical trial for Solaris. I watched or listened, not physically watched, but listened and participated in the conversations that were happening in Europe at the time, in England. And so I knew what was coming, hopefully to the United States. So I was able to get in contact with people. I was very much advocating for myself. So I had met with a doctor in the Boston area, I think maybe a year or two before it even started, because I knew that this was something that I felt could help the type of PNH that I had. And so I brought it back, all the information to my doctor and said, so this is what I want. We need to just find out the closest place. Thought it was either going to be New York or Boston. And he was really receptive to participating in that. I felt that I was healthy enough to participate, but I also had enough of the symptoms and criteria to participate. So I was unhealthy enough to participate, if that makes any sense. And so I felt that it was really important to me to be able to help not only myself, but also future patients, which is, especially with the double blind, sometimes people can get frustrated if they don't get the medication right off, but eventually you switch over to getting the medication and it's the information that they need to approve the drugs for the bigger population. So my doctor probably would have suggested it if I hadn't been too eager myself. I know that there's a bunch going on now, and I know that there are people whose doctors say, this is working well, but I think this could help maybe make it work even better, your fatigue level or your counts or whatever. So I think that the clinical trials, if you are a good candidate, can be very helpful for the person and for the PNH population.
Thank you. Brandy, how about you?
Yeah, I've never participated in a clinical trial, but definitely was always open to it. Like I said, I didn't really treat my PNH. I treated aplastic and PNH together. So I've never done a clinical trial. I remember the Solaris clinical trial came out when I was diagnosed with PNH, and I remember that being an option. And for me, I remember telling my doctor did actually mention to me, hey, Solaris is a new thing. They are doing a clinical trial on it. And the more we thought about it, I didn't think it was right for me to do at the time was to be on Solaris. But if I was, I definitely would have been in a clinical trial just because of there's not that much information there was at the time on PNH. And for me, doing anything that I can to help other people, I'm definitely all about that.
Brandy. With you not being on treatment, you had mentioned that you have a flow cytometry test done every 6 months. How often are you seeing your physician for monitoring outside of the flow cytometry test?
No, that's a good question. So right now I see my doctor every 3 months. So the next 3 months into that's when we'll do a flow cytometry. So we do this flow cytometry every 6 months, but I see him every 6 months. And most of the time we just do a normal CBC, looking at my accounts to make sure they're in line with me.
Heather, how often do you see your specialist?
So depending on how we define specialist, my specialist retired multiple years ago. So my PNH specialist, I haven't seen in a while. But as far as my hematologist, I see every third or fourth treatment. So every 2 weeks, I go to the doctor's office and they'll do blood counts and I'll have my infusion. And then every 3 or 4, so every month and a half, every 2 months, I see a provider in the office. They're also really great if I'm not feeling well, or if I call and say the fatigue feels more, shortness of breath is different, my headache is different. They will see if I can see the provider on one of my 2-week, 14-day visits. So it's flexible, but it's often enough, but I'm stable enough that it doesn't have to be the every 2 weeks.
Brandy, I think you had mentioned about brain fog earlier. Um, have you experienced the brain fog and how do you manage that? And then Heather, you as well. So Brandy, would you like to start with that one?
Yeah, so for me, yeah, the brain fog I probably right now is it's the worst symptom for me right now is having brain fog. I started noticing it getting really bad about it's been like 2 years ago now. I remember just not being able to remember things, and it really worried me just because at work and my job I have to there's important information that I have to remember, and I remember being just worried that it was going to really hinder my work or me being able to work. And, how is that going to look in the future if I can't remember things? So I remember bringing it up to my doctor and we talked about it. And I haven't been on anything for it, but I remember just really starting doing some brain teasers. Or my family started to notice it as well. Like I'd ask them a question, then 5 minutes later, it's like I was asking the same question. They were like, "Do you not?" I just said the answer. So they really helped me with really just trying to remember things. Honestly, I just started doing some brain teasers on my phone. I just downloaded an app to kind of help me out, just because I saw it was a real big problem. It's actually gotten better, but it is still there where I just don't remember things at times.
Is that something you discuss with your treating hematologist when you see them? Is that something that you guys keep track of? Is that something you would recommend other patients report to their doctor if they're experiencing this?
Oh, yes, absolutely. So it's something that my doctor is well aware of here and the one in NYU. So that's probably my main one. And we definitely keep track of it. So every 3 months is when we'll go over my symptoms. Other than that, we do talk about the bruising, which I haven't had bad bruising, but having those bruises. And so whenever I go in, I'll tell them if I have a new bruise and where it is, how I got it. We'll go through that whole thing as well. And then one minor symptom I also have is headaches from time to time from the PNH. I don't get a lot of headaches. So we talk about all those symptoms in all of my 3-month appointments. Yeah.
Heather?
I would say that I do suffer from some brain fog, but I think it's tied to fatigue. So if my counts are low, I do notice that a little bit less clear on my thinking. I do the autopilot driving sometimes, double checking my calendar, looking at the time, forgetting, looking at the time again. I think it kind of ebbs and flows as far as how intense it is. It hasn't been to the point where I feel like I need to have it tested. But I do think that when I become fatigued more, it is other people, like Brandy said, other people will notice it. I'm a little more distracted or repeating things. And so I can take the cues from them, maybe self-care or talk to my doctor or rest. So, but I do know that there are people that it does affect their day-to-day. And again, as you asked and Brandy said, I think it's important to talk about how you are feeling and how that has changed better or worse so that your doctor knows what your baseline is and what you are hoping or expecting your baseline to be.
Well, thank you both so much for sharing your time and your expertise with all of us today. This webinar was being recorded, so it will be available on our website within 2 to 3 business days. If you have any additional questions, or you can send it to us in 3 ways. You can either give us a call. Our toll-free number is 800-747-2820, extension 2. You can also send us an email to our help account at help@aamds.org, or you can submit a question on our Facebook page. On behalf of the Aplastic Anemia and MDS International Foundation, we thank you for joining us today, making us your resource choice. Our medical advisory board and team are always here to support you and your family, as we have done for the past 37 years. This concludes our program. Thank you again, Heather. Thank you, Brandy. Take care. Bye-bye.